Join me as I dive into the tough question of whether Ghana is really ready to face the economic shock of diabetes and hypertension. Ghana, like many countries in Africa, is grappling with a growing health crisis. Diabetes and hypertension are on the rise, and it's not just a health issue, it's an economic one too. The increasing prevalence of these conditions is putting a strain on the country's healthcare system and economy. The numbers are staggering. According to recent figures from the IDF, International Diabetes Federation, 2025, the prevalence of diabetes in Ghana is expected to dramatically increase over the years, with a large percentage of people living with the condition unaware they have it. The population is also projected to increase by 50%. World Health Organization 2025, increasing the number of people with diabetes and hypertension. Hypertension is also a major concern, with a high percentage of Ghanaians suffering from high blood pressure and stroke being the leading cause of registered deaths, both in young and older adults, male and female, WHO 2025. These conditions are not just a health issue. They have significant economic implications and huge societal burden. The cost of treating diabetes and hypertension is high, and it's only going to get worse if something isn't done. Although diabetes is lower on the causes of registered deaths in Ghana, one of the leading complications of diabetes is damage to blood vessels, over time, increasing the risk of strokes. The healthcare costs associated with diabetes and hypertension are substantial. From medication and hospitalizations to lost productivity and reduced economic output, the economic burden is significant. In fact, it's estimated that diabetes and hypertension are costing Ghana's economy millions of dollars every year. This is money that could be spent on other vital public services, but instead, it's being diverted to treat these preventable conditions. If left unchecked, the economic implications of diabetes and hypertension in Ghana will be severe. The country's already strained healthcare system will be overwhelmed, and the economy will suffer as a result. It's a bleak picture, but there is hope. With the right policies, public awareness campaigns, and preventive measures, Ghana can mitigate the impact of these conditions. So, what is Ghana doing to tackle these health challenges? The country's healthcare infrastructure is working hard to keep up with the demand, but it's a tough task. There are initiatives to improve public awareness and promote preventive measures, such as healthy eating and regular exercise. However, more needs to be done to address the root causes of these conditions. The healthcare system in Ghana is also trying to get ahead of the curve by investing in healthcare infrastructure and training more healthcare professionals. However, it's a complex issue that requires a multifaceted approach. The government, private sector, and civil society all need to work together to address the health and economic implications of diabetes and hypertension. Experts are raising the health concerns of diabetes and hypertension, warning that Ghana needs to act urgently to avoid a looming economic and health crisis. The statistics are clear. If Ghana doesn't get a handle on diabetes and hypertension, the economic consequences will be severe, not to talk about the social burden on Ghanaian families. In conclusion, the findings suggest that Ghana still has a lot of work to do to tackle the health and economic challenges posed by diabetes and hypertension. If you have any thoughts on this issue, please share them in the comments below. If you're interested in learning more about health issues in Africa and Ghana, check out our other YouTube videos on the topic for more insights. Thank you for watching and for your support. Please subscribe, comment, and share to other Ghanaians, friends, and families.